In this module, we'll be covering cognitive behavioral theories. Cognitive behavioral theories are actually a general category of theories. They're a set of many different related theories that have at their core the reflection of the importance of both behavioral and cognitive approaches to counseling, that both components have to be integrated. A quote by Albert Ellis that I wanted to start with is this one: "The best years of your life are the ones in which your problems are your own. You do not blame them on your mother, the ecology, or the president. You realize that you control your own destiny." This is the sort of philosophical, fundamental thinking that Ellis used to develop his theory. And that sense of self-control and responsibility, that's going to be covered throughout the theories. Okay, so within these theories, there are 4 common tenets that are shared across all cognitive behavioral theories. One is that there's a collaborative relationship between the therapist and the client. That does not mean that it's necessary to be a warm empathic in the sense that we may think of it from a Rogerian approach, or humanistic approach, but it's collaborative, okay? That's the first step in that, having the client to take responsibility. Second tenet is psychological distress is a function of disturbance in cognitive processes. The third is focus on changing conditions to change your affect and your behavior. And then treatment, the fourth, is that treatment is educational and time limited, and it's focused on specific and structured target problems. It's not more broad. Some of the main theorists we'll cover in this module will be Albert Ellis and rational emotive behavior therapy, Aaron Beck with cognitive therapy, and then Donald Meichenbaum with cognitive behavior modification. But there are more than 20 different theories that are labeled cognitive or cognitive behavioral. Rational emotive behavior therapy, REBT. This is one you've probably heard the most about, Ellis's work. This is considered the parent of all cognitive behavioral approaches. It was developed in 1955 by Albert Ellis. It has roots in this philosophical foundation that says people are disturbed not by things, but by the view which they take of them. And it credits Adler with the emphasis on teaching and persuasive methodology. Okay, so it grew out of an Adlerian approach in a sense. It says that people should accept themselves even if they make mistakes, yet at the same time they must learn to live more at peace with others. That you're in charge of yourself and you understand that others are in charge of others. Now the links in this little video won't work, but when you go to the full PowerPoint in the module, there's actually like 40-some slides. The hyperlinks will work. Okay. But what did Ellis believe? Ellis believed about the therapeutic relationship, that the empathic therapeutic relationship, a humanistic approach may be undesirable because the temporary mood elevation brought on by empathy, that deep caring, may make the client feel better and keep the client from doing necessary work to actually get better, to shift the faulty logic and thinking. Right. So it's collaborative, but that warm, empathic, humanistic approach, that's not what that's not a requirement for this theory, right? So the basic hypothesis is that our emotions stem mainly from our beliefs, evaluations, interpretations, and reactions to life situations. You feel the way you think. The emotions and thoughts are intricately connected. And therapy is essentially a process of re-education, a process of learning how to think more rationally about your own experience. So then the therapeutic focus is on working with thinking and acting from thoughts. The view of human nature is that humans are born with a propensity for both rational and irrational thinking, and we're born with propensities towards self-actualization and self-destruction. This approach that recognizes that people could go in either direction, and that humans are self-talking, self-evaluating, and self-sustaining. And within that control, we often sabotage our movement towards self-actualization. We do that as a result of our tendency as humans towards crooked thinking and self-defeating patterns that we've learned in our interactions with others. Ellis believed that humans do not need to be loved and respected, even though they may strongly prefer it. You can be successful, you can be happy, but that the love piece is not necessary. Emotional disturbance then says that blame is at the core of most emotional disturbance. Blame for situations, context. And it exists when a person makes the mistake of irrationally thinking that simple preferences, the things you want in life, are actually dire needs. That faulty thinking results in this emotional disturbance and dysfunction. During childhood, Ellis believed that we learn patterns of irrational, self-defeating thinking. And we create those patterns for ourselves. So we tell ourselves, I must have love or approval from significant people in my life. I must perform important tasks competently. If I don't get what I want, it's terrible and I can't stand it. How often do we say I can't stand it? In Ellis's approach, that's a place of work in counseling. This occurs when we escalate our desires and our preferences into shoulds, must, and oughts. Shoulds, must, and oughts. So to avoid emotional disturbance, we are able to maintain our emotional health by recognizing the difference between preferences and needs and taking a very rational view of our own imperfections. In Ellis's approach, they use an ABC theory of personality. You have an activating event, something that happens, a belief, and your emotional consequence, emotional and behavioral consequence. So in work, therapeutic practice, you go with the D. That's where you you engage an intervention, a disputing intervention. And from there you get an effect and a new feeling. You do that, the belief part. You're going to have activating events all along, but you can change your way of thinking about those events, that belief component. Individuals have goals that may be supported or thwarted by activating events. But when you approach an activating event, any event in your life like that, then humans react consciously or unconsciously within their belief or with their belief system, right? They apply their belief system. And that's how they respond to the activating event. And then the consequence is the emotional and behavioral result of the action. So that disputing intervention, detecting, debating, discriminating, that can be taught, and that's what therapy focuses on. And the effect of the disputing intervention is hopefully the successful challenge and dispute of irrational behavior. And then you get a new feeling that is hopefully logical, helpful, and rational. Therapeutic goals then are to minimize self-defeating behaviors and emotional disturbance, to acquire a more realistic and workable philosophy of life, and to reduce the tendency to blame yourself and others for things that go wrong in life. Reduce that blaming and learn for ways to deal with future difficulty. By minimizing those self-defeating behaviors, the process of education, and that process of education is then what the client can apply further down the line. So the therapy process is step one to build a collaborative therapeutic alliance. That doesn't mean a warm, empathic, loving, caring. Nope, it's collaborative, in which the client is empowered to be in charge of her or his situation. Step two is goal setting. And then 3 is the orientation of the client to the therapeutic process, to make the process to be clear and to work with to establish expectations. And then 4 is the counselor disputing irrational beliefs. So the therapist counselor is very active and engaged. Step 5 is an assignment of homework. I'm sorry for the title part there. I see that showing up. Sorry about that. So the step 5 is the assignment of homework. That includes a progress check upon completion. You don't assign homework and send your client home to do it and then not check back in at the start of the next session. No, you check back in at the next session to process that homework. Progress check, how did it work, and help to integrate those new ways of thinking and acting into their way of functioning. Then there's a reassignment. Step 6 is a progress review, a constant process of progress review and planning for the dealing with future problems. Now, if you go through the rest of the PowerPoint, there's an extensive PowerPoint available in the module, and you'll cover techniques, you'll cover different components of each of the cognitive behavioral theories we mentioned before. But the piece that I was hoping you would take away from this part of the presentation today is that sense of how this theory approaches counseling differently than the theories that we've discussed thus far, or from humanistic theories. This theory is not focused on the warmth and connection of the relationship between the counselor and the client. It is a collaborative relationship. The client is empowered, but the focus is instead on helping shift the client's thinking and logic and approach to processing information about their situations and to help them apply that for future issues. And the focus is on the specific presenting concern that the client has brought that day, that within that session or for that seeking of counseling. So it's less a process of insight building and more a process of re-education education about appropriate ways to shift your thinking, right? We're going to talk more about cognitive behavioral theories, in our module discussion this week, and there is more about each of these theories available in the PowerPoint that's in the module. Thank you.